In the greatest name of Almighty Allah, who is Rahman and Rahim, welcome back to the Dr. Najam Lectures. In this video, we will talk about the breast examination. Breast examination is commonly performed clinical examination. Its indications includes the mesalgia, changes to the skin of the nipple, changes to the skin of the breast, nipple discharge, or the breast lump. Alongside of taking clinical history, the breast examination is a key component for the triple assessment approach to the breast irregularities, in addition to the pathological assessment and the radiological assessment. The breast cancer is common type of malignancy all around the world in the women. Therefore, it's important that all the medical doctors or the junior doctors or the medical students know how to perform the breast examination. Before starting the examination, let's introduce yourself to the patient, ask her about the identification and explain about the procedure, that what we will do and what includes in this. And it's important that there should be the presence of one female chaperone, and this chaperone also introduce herself to the patient. Then take the verbal consent of the patient. After washing the hands, putting on the gloves, then start the examination of the breast. For the examination, patient should be exposed from up waist and sit on the edges of the bed like this. So we can start the inspection of the patient breast or the palpation of the patient's breast. The general inspection of the breast is done by asking a patient to place the hands towards the back of the head like this. Then we look for any kind of the asymmetry in the breast, scars in the breast, and also the nipple abnormalities or the swelling at the breast. Then we ask a patient to place the hands upon the hip like this without contacting the pectoralis muscle. Then inspect again the same, the symmetry of the breast, any scars in the breast or the lump or the swelling or the nipple abnormalities. And also inspect the skin changes like the pudoma range or the eczema. Then we ask a patient to place their hands into the hips like this and contact the pectoralis muscle. And after that, inspect the same thing like the scars on the breast or the swelling at the breast or the lump into the breast and any skin changes like the pudoma range or the eczema. Then ask a patient to lie in semi-reclined position like this and stand by the right side of the patient. And if patient reported any kind of abnormality in the breast, so first we have to look at the normal breast, then to the abnormal breast. Now, palpation. First of all, ask a patient to place the hand towards the back of head like this and inform the patient the palpation is not painful. If you feel any kind of pain or discomfort, just let us know. Then we systematically examine the whole breast with the flat of our fingers, starting centrally at the areola and palpating clockwise. Centrally. And also palpate the axillary tail of the breast tissue, which extend towards the axilla. Next, we palpate the nipple. We gently squeeze the nipple to see if we are able to reproduce any discharge, if patient reported this in clinical history. Now, we will examine the patient's axilla by lowering her arm like this and support the arm like this. But this is a model I cannot show properly to you. I will perform on myself. So, patient's arm should be like this, and you can support from that side and start palpating the anterior wall of axilla, posterior, lateral and the medial. And in the last, you can also palpate the apex of this axilla. After that, We will perform the same palpation like we did on that breast, like for example, supporting the arm towards the back of the head, lowering the arm, and the palpation of whole breast and palpation of the axilla. In the end, for any kind of lymphadenopathy, we will also palpate the infraclavicular region and the supraclavicular fossa also. Then we inform the patient that our examination is done and thank to the patient. And if during examination, if we noted any kind of the lump in the breast, we need to document this and make a comment on this, like the position of the lump, size of the lump, consistency, and its relationship with the other structures like the skin or the muscles. So this was completely about the examination of the breast. I hope that you like this video and do subscribe to Dr. Najam Lectures.